Cha kwanza kabisa, maji ni uhai, lakini maji nimeshayaona kama vile yana madhara sana kwenye familia yangu, maana nitakuwa ninauelewa zaidi kuhusiana na jinsi ugonjwa wa kichocho unavyoenezwa, na ninaijua ipo. Kuna dawa nilienda kupewa na daktari pale kwenye zahanati ya kunywa watoto. Kila siku nikiamka lazima niende shambani kwenye mpunga. Ili niingie kwenye mpunga lazima nikanyage maji. Majukumu ninayofanya wakati ninajishughulisha na shughuli za kilimo, cha kwanza kabisa ninaenda na watoto wangu kunisaidia kazi za shambani. Kila siku wanapitia kwenye maji wakitoka kwenye kilimo na kunawa na kuoga. Sasa kweli siwezi nikatambua maji ambayo hayana maambukizi ya kichocho, maana sina uwezo wa kuyapima kwamba ya maji ni salama au sio salama. Mtoto alikuja ananiambia, baba, najisikia maumivu nikienda kukojoa. Inabidi nimchukue nimpeleke kituo cha afya pale zahanati. Kaenda kuchekiwa, nikaambiwa ana kichocho. Kuna watoto zaidi ya 3 walishawahi kuugua ugonjwa wa kichocho. Kwa najisikia maumivu sana, maana wale watoto ndio familia yangu, ndio wanaonisaidia kila kitu. Sasa wanapougua,
Schistosomiasis is a parasitic disease caused by worms. Under the microscope, Schistosoma worm look like this, and they have a very defined head end, and then they also have other structures which make them look peculiar compared to earthworms. Some eggs are also different. They are oval, but with a spine. For schistosomiasis to be actively transmitted, it needs one to be in contact with infected water. The interface between freshwater snail and human, that's where the infection happens. It enters into the freshwater snails and hatches into larvae. And then the snail will be shedding out the larvae into the water body. This innocent snail doesn't know that it's perpetuating the transmission of schistosomiasis. There are several consequences when one contracts schistosomiasis. For children, one of the negative impacts is stunting because the blood-sucking worms deplete micronutrients in the body. A child with the schistosomiasis is likely to suffer from malaria easily. And then we have evidences of bladder cancer when people grow older. In the past, many people didn't consider schistosomiasis as the disease which can affect children under the age of 6. Around 2010, researchers working on schistosomiasis started shouting about, hey guys, even children under the age of 6 contract schistosomiasis. They play in the same environment, they go with their parents in the farms, so they are equally exposed. So it's worth considering these folks in the treatment program. So it took over 12 years to gather evidence, interact with public health specialists, everyone to contribute their thinking. And that demonstrates the commitment the Wellcome Trust has in advancing public health in the world. Now, under 6 children are being properly included in the guidance. It's my duty to study the problems of our people. We developed a project which had several phases. We are terribly excited as a team, being among the very first public health institutions in the world to deliver the new drug to its citizens. When we received the first consignment of a new drug, it was like a far-fetched dream. When we look at the old preschool compared to pediatric tablets, the biggest difference, number one, is the size. Number two is how easy it is for the tablet to dissolve. The old preschool doesn't dissolve easily in water. The new formulation dissolves very quickly. The other biggest difference is the taste. The old preschool is bitter. The new formulation for pediatrics is sweet. Kids are swallowing the medicine without any problem. You don't see them squeezing their face because of the taste. The consortium which developed the new drug is called Pediatric Preschool Consortium. The consortium has successfully closed the treatment gap, and it is one of the best milestones ever. All these things have been made possible because of partnership. By treating schistosomiasis at the early ages, improves the health and well-being of the children and their growth. So they will develop well, they will reach their full potential and be good citizens. There's still a lot of work to be done, mostly on community education. There's the social intervention. That's number one. So I'm not a kind of a researcher who would want to sit in the office all the time. I've done community engagement. I've gone to all the sites. The community members, most of them are unaware of the life cycle of schistosomiasis. You see a colony of snails. I'm trying to see whether we may have an active transmission. So now we have a strategy involving community health workers. They hold meetings. They speak about the symptoms of schistosomiasis in children and take the children to treatment.
Ndio nafurahia sana kwa sababu tena nimefurahi sababu nimepata elimu kuhusiana na ugonjwa wa kichocho. Familia yangu na wakaenda kutibiwa, wakapewa vidonge, ila kwa siku hizi niseme tu kwamba nakuwa na imani kubwa sababu nitaishi maisha ambayo hayana maradhi ya kichocho, na familia yangu itaishi maisha mazuri sana.
We are already seeing the impact, the demand, the community is happy, the intervention has reached the target, and we are collecting more evidence to help our government and other countries in the region. So it's a great moment, and it's one of the biggest milestones in my career.